Good afternoon, everyone. My name is Dr. Raquel Romero, and I want to be the facilitator for the ECHO session today. Thank you for joining our Communicating with Confianza, and I hope you and your family are doing well. It's really, really, really hard for this area, so please be careful, and thank you for making the effort to join us in this session. Communicating with Confianza is a health literacy echo. So this echo is brought to you by the Health Confianza team in collaboration with UT Health San Antonio, Super Hub, the YWCA, the South Central EHEC, and the University of Texas at Austin. Now, for those that are not familiar with who we are, Health Confianza is a community-wide health literacy program that aims to provide health literacy education, training, resources, and workforce development for Bejar County and the surrounding areas. Our team believes that health literacy is critical to transform health and achieving health equity for all. Confianza is the Spanish word for, and that means trust. The sessions are building each other, and this is our last session of this season. So thank you so much for those that is being with us every time. You will see in this echo session that we're going to have a didactics, and then we have a case presentation. Part of the echo session is devoted to have a dynamic discussion discussion related with the real life cases that are presented by members of our community like you and me. So to ensure privacy, please note that no personal health information is allowed at any point in these sessions. What is personal health information? Well, we want to talk about the DOB. This is the PHI, day of birth, addresses, appointment dates, etc. So please don't share this information during this discussion. Now, before we go to the team introductions, I would like to ask if you please enter in the chat your first and last name. This is for our attendance records. You can also rename yourself in the Zoom session, and please stay muted only you are speaking. But if you have any question, we have an IT person here present. Kato can help us, so please you can send a message to her. But we encourage to everyone participate. We want to have a dynamic conversation, and we all learn in these sessions. So if it's possible and if you are able, please unmute and be in camera for the discussion part of the session. So I would like to go in for the introduction. So I would like to start with Dr. Rosenfeld.
Hello, good afternoon, everyone. Good to see you on this rainy Friday. Jason Rosenfeld, I'm an associate professor, Department of Medicine, and co-director of Health Confianza. Excited to spend this last echo session with you today. Thanks.
Thank you very much, Dr. Rosenfeld. Dr. Stone.
Hi, everyone. Good to see you. I'm glad that we have this virtual option to meet, so we don't have to go out into that weather. I'm a co-director of Health Confianza, assistant professor here at UT San Antonio, and excited to engage with you in our final echo session.
Yeah, thank you, Dr. Stone. Dr. Stone is also the lead specialist for today. We have Dr. Adelita Cantu.
Good afternoon, everyone. Again, thank you for joining us on this Friday afternoon, a rainy Friday afternoon, and glad to be here for our last session as well. I am a professor at UT San Antonio School of Nursing and working with Jason, or Dr. Rosenfeld and Dr. Stone on Health Confianza. Thanks.
Thank you. As we mentioned, we have a case that are presented during the session, and Dr. Cantu is presenting the case for today. And also we have Dr. Manalili.
Hi, good afternoon, everyone, and thank you for the opportunity to be here today. And I work here at University Health. I'm the executive director of 2 medical surgical units here, and I'm also honored to serve as the chair of the San Antonio Nursing Consortium. I'm also the chief executive officer of the Academy of Medical Surgical Nurses San Antonio chapter, and I'm a elected board member of the Texas Nurses Association District 8, and I'm also one of the past presidents of the Philippine Nurses Association of San Antonio.
Quite an honor. Yeah, what an honor to have you here in our session. Dr. Manalili is presenting the didactics. Again, it is an honor for all of us to have you, and also it is a great pleasure that you all are here with us in this session. Finally, I would like to say that ECHO is all teach online environment, so we invite you and I encourage you to be part of the discussion today. With no more from my end, Dr. Manalili, on your time, if you can go ahead and present your didactics today. Thank you so much.
My pleasure. Okay, so ready?
Yes, you can go ahead and share your screen.
Yes, we are
Okay.
ready.
So you're seeing everything, right? All right. Because
No,
my screen.
Not yet. Not yet.
Oh, not yet. Oh,
No,
let's see.
we don't know. We don't.
Yes, it's the screen that I have is hold on. Share screen. There. About now.
Yes, now we are.
Okay. And I just see the PowerPoint. I don't see everybody. So bear with me. If you have any questions, anytime at all, just call my attention, please. Okay. So
Yes,
my topic for today is championing health literacy and better health outcomes through nursing partnerships, a path toward equity. Today, I want to talk about something that sits at the intersection of leadership, community, and impact. How we, as nurses and healthcare leaders, can champion health literacy and improve health outcomes through meaningful partnerships. Because at the end of the day, advancing health equity is not the work of one organization, it is the result of intentional collaboration, shared vision, and collective action. So, as I introduced earlier, myself, I'm the chair of the San Antonio Nursing Consortium. And you might ask, what is the San Antonio Nursing Consortium? So, um, after this one, I will also introduce everything that we do, the consortium, with the help of all its members. And the San Antonio Nursing Consortium is an alliance of several nursing organizations, and we also have one nursing student association, which is the INSA. So all of these professional nursing organizations are based here in San Antonio. And the purpose is to promote collaboration, strengthen the collective voice of nursing, and advance excellence in nursing. Of course, this is through practice, education, and leadership, innovation, publication, education, and of course, patient safety. So this is just a picture of all the chapter presidents of all the member organizations of the consortium. So we call it SANC, or of course, the whole name is San Antonio Nursing Consortium. It's been 8 years that this consortium has been existing and helping the community through, its signature events. One is the annual Patient Safety Conference, wherein we invite subject matter experts to discuss pressing issues or whatever, what is the need of the community, the nurses, whether they're leaders or bedside, and of course the best 25 nurses of the South Central Texas, which is a recognition of all the nurses, whatever field that they are specializing in, could it be in academia, research, bedside, leadership, and so on and so forth. So we're really proud that we have this strong collaboration and we work together because we have a common goal, and that is to, of course, to advance the profession of nursing through our various initiatives. So our goal, okay, is very straightforward but powerful. We aim to elevate nursing practice and leadership, strengthen education and innovation, promote research and dissemination, and ultimately improve patient safety and outcomes. What's important here is that these are not siloed priorities. They are deeply interconnected. For example, you cannot improve patient safety without strong education, right? And you cannot advance innovation without leadership. And you cannot achieve health equity without all of the above. So our work is not just about programs, it's about building a system of influence. So these are the active organizational members of the consortium. As you can see from the Academy of Medical Surgical Nurses of San Antonio down to Texas Nurses Practitioners, all their leaders are very, very active with all our signature events. And we also help each other because each organization, each chapters have their own events as well. So we share all the information and we support one another in order to, as they say, there's strength in numbers, right? So the more that we join forces, the more we become impactful and influential. So we bring together diverse nursing organization, each with its own expertise, network, and reach. This diversity allows us to expand our impact, reach broader populations, and address complex health challenges from multiple angles. Because no single organization can solve health inequities alone, but together we believe to close those gaps. So as I mentioned earlier, each organization, each chapters have their own events. It could be annual, monthly, or quarterly, and we disseminate all these flyers with one another, even outside our chapter, so that we can invite attendees, we can invite members, and like I said, there's strength in numbers, right? So the more we join forces, the more impactful we are. Um, these are just some of the pictures of our meetings. So we do biannual meetings, and sometimes we also call for special meetings to discuss, our projects, or like for example, our bylaws as well. If there's any need to update them, any events that are upcoming from each chapters, and if they have any concerns at all, or if they need any help from one another, from the consortium, we hear, we listen, and we help. Okay, so this is one of the signature event that I've mentioned earlier, the Best 25 Nurses of South Central Texas. Last year, we have a staggering 700 nominations. 8 years ago, we just started with like 200 or less than 200, and now it's growing, 700, and we're hoping to beat that this year, come December. So this was the picture last year, and we get the support of our city leaders. As you can see, Mayor Gina Ortiz-Jones. We have Mayor Ron Nirenberg before, and we have Judge Sakai as well supporting our events. Okay, so this is where our work becomes truly impactful. Our community partnerships are centered on advancing health equity through priority focus areas, cross-organizational collaboration, engagement with underserved populations, and collective advocacy. Let me emphasize this. Health equity is not achieved through isolated programs. It requires trust, presence, and sustained engagement with communities. Through these partnerships, we are able to meet people where they are, address social determinants of health, and co-create solutions with the communities we serve. This is the shift from delivering care to partnering for health. One of our most visible efforts is in health screening and education. These initiatives are designed to improve health literacy, which is a foundational driver of outcomes, because patients cannot engage in their care if they do not understand it. Through community-based screenings and education, we provide early detection, offer culturally relevant education, empower individuals to take ownership of their health. And when we improve health literacy, we are not just informing patients, we are changing trajectories of health outcomes. So these are examples of the walks we support, like the NAMI walks, and other things. We have so many photos actually, and I would like to invite you later on to just visit our Facebook page so you can see all our initiatives. So this one is with the San Antonio Nigerian Nurses Association. They do that as well yearly, and they have annually they have different topics, and they invite subject matter experts as well. So the same thing for the other organizations. It could be a fundraising activity for their major project, or it could just be addressing the community with their health literacy needs. So these are pictures of our health fairs. We partner with the UT San Antonio. I know that you know Dr. Bennett Bloom and the INSA. They join us as well. And whenever there's a call, they invite us to join them. So it could be, for example, during the COVID season, we volunteer to do vaccinations, and different health fairs. Um, um, uh, Probably, like, for example, taking their blood pressure, educating them on how to do sugar check at home, and so on and so forth. These are also some examples of our community outreach, like we do back to school supply drive last year. We partner or communicate with some school leaders, and identify which school or which part of the community really needs help. So we go there and bring all these donations from all the members of the organizations, and even our colleagues at work, they donate. This one is we volunteer and we also donate to our San Antonio Food Bank. It really feels great and very um, enjoyable doing this, because we all know that we help the community in our own little way. Another critical area is environmental health. We partnered with the City of San Antonio on a climate readiness initiative a couple of years ago. It is a campaign focused on raising awareness about the health impacts of climate change. This included community-based education, public awareness campaigns, and dissemination of critical information. We bring this poster with a QR code there, and we invite everybody to take that QR code and go to that link and signify their support for the project. So this work reflects a broader understanding that health is not just clinical. It is influenced by where people live, work, and interact with their environment. And as healthcare leaders, we must expand our lens beyond the hospital to the conditions that shape health outcomes in the first place. So this is the poster that I was, or the banner that I mentioned earlier. We bring this in the different communities that we go to, and we provide education. Even in our events, we bring that banner, and we entertain questions, we answer questions, and it was really amazing how a lot of people are really concerned about the climate change. And aside from the San Antonio Nursing Consortium, this was also being promoted by our members in their individual events, like, for example, the Philippine Nurses Association of San Antonio and the Philippine American Chamber of Commerce Central Texas region. We also focus heavily on patient safety and emergency preparedness. Through partnerships, we have implemented annual patient safety conferences, active shooter preparedness training, and the Stop the Bleed initiatives. These efforts strengthen both healthcare systems and community resilience, because preparedness is not optional, it is essential. And nursing plays a critical role in ensuring that both systems and communities are ready to respond effectively in times of crisis. So every year we have different topics that we present. We invite subject matter expert. I believe Dr. Cantu and some of our amazing professors at UT have been our keynote speakers and invited speakers. And each year we have about 200 to 250 attendees. So these are just some of the posters that we have. And this year in August, we'll have our 8th patient safety conference. So very well attended. This was in 2024. And this was last year, because AI is the center of attention in the last couple of years. I mean, recently, right? So that was our topic last year. And we again had about 200, 250 attendees. We also have poster presentations. So we invite everybody from the different hospitals to submit their abstracts, and we really had a great turnout. So these were our speakers last year for the AI in Nursing, Revolutionizing Patient Safety and Practices as our title. We have Dr. Zizi, and we have Dr. Bryson of our partner at Methodist. Okay, stop the bleed. So um, each we do train the trainer classes, whoever or whatever organization that approaches us to train them so that they can also train their members. We're actively doing that. Actually, on May tomorrow, we have one that we're going to have, and we invite everybody to participate, because we really need to prepare the community just in case something happens, like what we witnessed before. So we have Spanish-speaking members, and if they need to teach in Spanish, they do it. And if they have a different language, we make flyers that that they can use and understand. So different levels. It could be our regular people in the community up to our resident doctors. We do not choose any group. We always come and teach this class. So in conclusion, through aligned partnerships and coordinated initiatives, SANC strengthens health equity by expanding access, empowering communities, elevating environmental justice, and enhancing patient and community safety. So please visit our Facebook page for more information. You will see all our initiatives there, all our activities, all the pictures, and some of the good supporters that we have from the community. And we are very thankful and grateful for the collaboration and partnership, because this is for the community, for health literacy. It's very, very important that everybody should be aware of what to do, whether it's how to take antibiotics, how to take blood sugar in the morning, wound care, for example. During health fairs, we encounter all of these questions. Very simple, but very important, because it's very important for patient safety. So thank you, and if you have any questions, I'm ready to answer them.
Thank you very much, Dr. Manalili. This is very, very interesting and very important information. As you say, patients cannot engage in the care if they don't understand, right, what they are encountering, like you mentioned, medications or little simple things like check your blood sugar, when, at what time, right? Yeah, thank you so much for bringing that. Yeah, yeah. There is a comment from Kendra Lee Carpenter. Do you would like to articulate that comment, Kendra? It's so important, she said. Kendra, I don't know if you want to elaborate a little bit more.
I just am so happy to see that y'all are just collectively addressing climate change and making people aware of how it will impact our health, because I mean, it's going to impact our health on so many levels, and especially when it comes to people that are marginalized, that don't make as much money, because they won't be able to, properly cool their homes, and children that don't have access to covered playgrounds. And issues like that. But also it's going to affect the way that disease spreads, and bacteria and mold forms, right? And fungus.
Agree.
And it will progress those types of things. And so I think it's so important that, as a health community, we are actually bringing that to the attention of people. And then I also wanted to say, the Stop the Bleed, is that that's your organization that does those trainings?
Yeah, so for those who are not aware, this is uh, formulated by the ACS, right? And then we attended the training, and then we have our experts here at university that went to our meeting one day. We invited them, and then after that, we carried on. We volunteered to be trainers.
Okay, awesome. So it's just funny because I literally just posted a flyer for that being presented by Child Safe for children. Are you guys performing
Yeah,
that
yeah.
training?
You can invite us because we also participate in the Child Safe. We donate toys as well. TNA, I believe, and Sigma are the ones that are spearheading this among our SANC members. So we go there and then we can, if they invite us, you know, to do the Stop the Bleed training, we're more than willing to do that.
Well, thank you so much for all that you do, and thank you for the wonderful presentation.
You're welcome.
Thank you, Kendra. I want to go with Dr. Anita Cantu, but also in that regard, this training is offered every once in a while. You say there is one tomorrow, right? One training for the Stop the Bleeding.
Yes.
But is there
Yeah.
another one coming?
I know there's one invitation in June, so we haven't because we meet at the common schedule, and then we ask our members who are available. We bring at least 5 members or more than 5 because depending on the availability of the nurses, and they're very eager to really volunteer. As long as they're not working, they're willing to come and teach. There was a time that we taught the whole day, from adults to children. Just imagine how to teach like grade school children and how to do the Stop the Bleed. So we have to, adjust how we, use words, and it's really fun actually because you will be amazed what questions they ask, compared to the adults, right? So even in health fairs, sometimes they will ask like, it's the first time that you will hear right those questions, and I'm glad that as nurses, we have all this knowledge that we can share, no matter what group, no matter what age, and we're able to give answers. And if we don't have any, we refer them to we give them resources, and we refer to them to groups that can provide the answers.
Oh, that's always very nice. I really love and I have a lot of respect for all the nurses, for all the work that they do. It is a passion in there. So thank you so much for doing that. Dr. Cantu?
Yes, I want to also say thank you very much for the presentation for today. It relates back to what Kendra was saying. I was just reading an article this morning that spoke to antibiotic resistance becoming more of a problem as the environment heats up. And this article says that because microbes in the ground are changing, are mutating to become more resistant to warmer temperatures, the plants that grow in this environment or the soil then and used for antibiotics may lead to resistance. So we could see those diseases in which we normally would have antibiotics to take care of that may not, in fact, be helpful in the future. So environmental health has so many of those intricacies that we really do need to get the word out in terms of that. And then the second thing I wanted, again, with the Stop the Bleed, but I do like your one sentence there where you said emergency preparedness is not an option. It's a requirement for us all, and I'm going to steal that and use that for my nursing students. Okay, so thank you very much.
You're welcome.
I thought to Dr. Cantu, it's not an option. We have to be prepared. We need to, right?
It is essential. Yeah.
It is essential. It's critical. It is so important that we put that in our mindset, right? That it's like we have to do this.
And more importantly, how people in the community, how we can impact the community members by letting them know the importance of that and helping them be prepared.
Yes.
And there is another comment from Kendra. It says parasites will also become more virulent in humans.
Yeah,
definitely for this change, and we see that, right? We perceive the change is it is important to know more about it. But is there another comment or question before we move to our case presentation?
I'd like to ask one. I'll be kind of wrapping us up at the end, but I wanted to go ahead and ask you, you have this great large conglomeration of health professionals who believe in health literacy. I don't know if you were able to attend our last session on ECHO, but we talked about system level advocacy work. And I'm wondering if your organization, the CENP, is doing any advocacy work to help, strengthen our case to integrate health literacy into systems and organizations, because right now we don't have a mandate to do that. And nurses are one of the, strongest voices we have for being able to tell what is going on with patients, with the community. So I just wondered if there was any advocacy work in your organization.
Actually, the annual event, the Patient Safety Conference, that is very much supported by the different chief nurse executives of all the major hospitals here in San Antonio. I would love to have that, like maybe do one program or main topic to advocate, right? So we will meet. We will have our biannual meeting next month. So that's a good point, Dr. Stone. And I will bring it to the team. So I know Dr. Nelson Tuazon and I met with Dr. Zawan last time. The one that we're building right now is the use of AI in healthcare. So that's the one that we're cooking right now. So, but about maybe one topic about patient care, clinically, for example, maybe that's a good one that we can formulate and come together and do something big, to help our patients. Yeah.
I just as a little plug, and I can talk to you more about this online, but I'm in the leadership of a brand new health literacy organization called the U.S. Health Literacy Association. That's their whole goal is to bring policy and practice change for health literacy. So if you're interested, I'd like to talk to you more about how to get your organization involved with that.
Yeah, I would love that now. Yeah,
awesome.
Thank you. We always like those opportunities.
Great.
Thank you.
Yeah, and we love to hear that, because this is the essence of ECHO. So we get all connected, we all learn together, and there are always an opportunity. This is what I love about ECHO. So just keep talking. This is very, very nice. Thank you so much.
Yeah,
thank you so much.
Yeah.
And thank you so much for this wonderful presentation. We learn a lot. Thank you. I was taking my notes. With that, I would like to just use it as a bridge, but I would like to then ask Dr. Cantu for that case. Thank you so much.
Okay, and I'm going to share my screen.
Thank you.
So I do have let's see. Okay. Can I share, do I need to be, okay, hold on, let me see. Am I sharing my screen now?
You're sharing your screen, but we
okay.
are, okay, that's perfect. Thank you.
Okay. And let me move this here. I think you want me to, I'll take off the closed captions. I think this speaks to Melanie's question or comment about system level mandates that could assist, could help us all. So I'm hearkening back to my very younger days as an assistant director at the old Brady Green. I don't know how many of you remember the old Brady Green. I worked there for a number of years and was started out in their walk-in clinic as a supervisor there, and went up to associate director or assistant director there. But this is when I was at the walk-in clinic. So the way we worked at the walk-in clinic is that a patient would be seen, then the doctor would write information down, or the plan, I should say, and then speaking to a nurse to discharge them. give them their instructions, making sure they understand it. So there was an older adult that was actually in their medicine clinic. I knew that she was a patient of the medicine clinic. I was in the walk-in clinic. This was a medicine clinic. I met her in the community. I'd known her before. Talked to me about her issues. She thought she had high blood pressure, took her blood pressure. I referred her on to her doctor at the medicine clinic. We made an appointment, etc. And so that doctor was known to me, but I referred her to clinic, make the appointment at the clinic with that provider. So she went, was put on high blood pressure medication, but she was also put on a statin. Then a couple of days later, I ran into her again in the community, and I asked how everything was going. Is the medication, any problems with it, anything at all? And then she told me at that time that statin, she hadn't started that because she had heard that. Then this was she heard on TV that this was before the the social media craze that we have now. But this was she said that she had heard on TV that you could not take or eat grapes if you're on a statin, and she likes to have grapefruit each morning. So I was like, not that. I just said, I just listened to her, we talked more about it. And I said, you know what? I'm going to see if I can have the doctor call you to talk a little bit more about the medication. So I did call a nurse friend in the clinic. I said, would you tell the doctor to give this woman a call and talk about this issue of grapes and thinking grapefruit is a grape and all that kind of stuff. So sure enough, the doctor did call the patient and she said, oh, she understood what the doctor was saying. She went ahead and started on her statin and, all that, her medication, she continued on her medication regime. So I'm going to stop sharing now because I think there were lessons learned for me. And I think it could go up to even a system level mandate. Anytime a patient starts on a new medication that's new to them, I think it is worthwhile for a clinic or for a physician's office, a provider's office, to just pick up the phone and call the next day and ask, do you have any questions about your medication? Were your medications okay? Anything else going on? And, since that was a lesson for me, and I've tried to be that way whenever I hear of somebody who's on a new medication. Let's talk about it more. Do you understand it? Any other questions? And so when I'm looking what might have happened here is that when that older adult was being discharged, whether she had any questions about it at that time, or the nurse possibly didn't ask, do you have any questions about this? So I don't know where that might have been a disconnect, but the result of the disconnect is if I hadn't talked with her in a couple of days afterward, she might never have started her statin because she wanted to eat grapefruit. Yes. And which I understand completely. And so, I wanted to present it as other lessons that you may think of from this case. What else might have closed that gap when you're looking at a place like the Brady, which is at that time a very, very busy setting.
Yeah.
Very busy. And also, could we do something at the pharmacy to also try as a stopgap measure? And then you're thinking of other clinics where it's very busy. I do know one of the things that when I've gone to a Care Now or an urgent care clinic, consistently they call me within 24 hours to ask if everything is okay. How can we get that at a systems level where this is just a given? Person starts on the new medication, they get a call the next day. They may not answer the call, but now, you know, a text. You have any further questions, please call in or something like that. So just wanted to bring that for a discussion.
Yeah. Dr. Cantu, if I may,
Mhm.
because I see that here in the inpatient world, right? Because sometimes patients, they have, you don't know what's going on in their mind. And then at the same time, we have patients from different educational level or background, right? So what we teach our nurses here is, whether it's an old or a new medication, they really have to take time to educate the patients or their family, at least if our patients are confused or elderly with dementia. So if they have family members that can receive the education, and then do not stop like after giving the lecture, or what is the medication, what's the name of the medication, what is it for, when to take it, and so on and so forth, right? So you do not stop there. We want them to validate, right? The nurses should ask the patient, sometimes, not sometimes, we recommend to let the patient repeat what the nurse explained, right? Not because we don't trust that they understand, but just to validate if what we say is like, I just want to make sure that I have given you the right information, and that you understood it the way I want you to understand it. And then they will repeat, and then from there you will see that there's so many disconnect, there's so many gaps, right? So it could be
Exactly.
language barrier, or their mind is somewhere else, they want to go home already, pay bills, etc., etc., right? So it's very important that as soon as you explain the way that they understand the way they would understand it, we ask them to repeat, right? If they totally got everything that was explained to them, right? And then we assure them that we just want to validate if we gave you the right information or the right presentation of this medication. And then we do discharge calls. So the next day, like for example, if they discharge today, tomorrow we call them, and then we follow up if they have other questions. And I see at the discharge pharmacy, when the cashier would call the pharmacist if they have any questions at all, that's an opportunity for the patient. We have to teach them that, take that opportunity. If the pharmacist is asking you if you have any question about, especially if it's a new medication, they should grab that opportunity, because sometimes they're in a hurry to go, and then they miss that opportunity already. So it's very important to make them, focus on that
Right.
time, that when
Is,
we educate them.
and I'm wondering, is that where you call them in 24 hours? Is that a system level policy?
So there are some hospitals that have that as a hospital initiative, right? So here at university, there's a group of people that do the discharge call, and at the same time in their after visit summary, the AVS form, there's a number there to call. It's a 24-hour hotline that they can call if they have any questions, and we emphasize that before they leave the patient room. So we tell them that in case you have any question, like when you get home, suddenly you remember a question or something that came to your mind that we weren't able to address. So this is the number to call, and they will answer the call, and they will direct them to appropriate person to help them out.
And that's a really good,
Yes.
if we could do that in clinics, in primary care, in primary clinics.
Yeah.
Yeah, how important is that, Dr. Cantu? Because it's not only that they could or couldn't understand, is the overwhelming situation when someone is
Yes.
in charge. It's so many things, so many papers, and it's like,
Yes.
Yeah.
That's
right,
true.
can be overwhelming. Even if and the call is just, did you get the medication? Did you pick up the medication? Right, because it can be that the case they didn't go to the pharmacy.
Correct. Yeah. So
Yeah.
Kendra is correct. She says teach back. That's teach back.
Yeah, it's stage back. Yeah, exactly. Dr. Stone, you raise your hand.
Yes, thank you. So yes, I'm glad you identified teach back. That's been one of the health literacy practices that we have talked about in our ECHO series, and it's such an important one. But I wanted to kind of go back to Dr. Cantu's case with her patient and kind of dive little bit deeper into this, because I do agree that if at the time of discharge of the patient, if we had used teach back, we asked the patient how she was going to take her statin medication, that would have identified right there, because she would have said, well, I'm not really going to take it because I want to eat grapefruit or whatever. So you would have identified right there the issue. The issue with asking if they have questions, first of all, our best practice says, what questions do you have, to invite those questions versus do you have any questions? But what I'm thinking, if I was this woman who was given this medication and I just knew that I wasn't going to take it because in my mind, I was like, well, I can't, eat grapefruit if I'm going to take this. I don't know that I necessarily would have asked a question about that, because I've already made a decision, right? So I'm going to just not take it. I'm not going to ask you about it necessarily, right? So that, again, I think using the teach back is probably the best way of capturing those discrepancies, because she would have had to say something, right? She would have had to say something about her taking that medication. So that's one point I wanted to make. And then the second one is how, I want to congratulate UHS for putting these health literacy practices into practice, because when we're trying to make the case for health literacy, going back to our last session about advocacy, and we still are far from getting organizations to adopt this practice. For some reason, it's hard to make this return on investment case. But if we have stories, if our providers provide these stories, like Dr. Cantu's patient, think about what would have happened if she had needed the statin. She never took it because of her, misinformed thoughts about it. She would have ended up back in the hospital with a severe, case of something that, cardiovascular, that would end up costing the system a lot more money than, if they had simply made sure she really understood what she was supposed to do. So I think having those stories, sharing it with your leadership can be really powerful, because those should be helping us make the case for health literacy.
Agree.
100%. It's very good points. Berta Rodriguez.
Hello, everyone. I wanted to bring in a family care perspective who has a mother, 81-year-old mom, who's very compliant in the office, who follow-up post-appointment is the best approach for her, because she will sit in the doctor's office, nod, and, take what she's being given. And I've heard her tell me, I'm going to speak in Spanish, yo voy a decidir si me lo tomo o no. I'm going to decide whether I take it or not, which is now made even more challenging that she's learned how to use her smartphone and finds a lot of information. And last week we had this very similar thing happen with an optional, I will call it optional, medication that they prescribed her, which was Zoloft, 15 days. She was exhibiting symptoms of a need for it. It was a short-term 15-day course. One, I think the doctor maybe overreacted in seeing her in the state of tears over some traumatic event that had just occurred the previous week, right? So it was episodic. But then two, didn't go over the side effects with her in clinic. And because she takes 10, I'm making probably exaggerating, medications, there was a need for looking at that from a side effects perspective with the existing medication, but also for her personally. She called it veneno. It's poison. I already read about it. I already know. I didn't take it. I'm not going to take it. So there's all of these things that come into play in clinic, post clinic, that I just wanted to bring in. This is so relevant to me right now because it just happened last week. So thank you for all the care that's being going into creating systems, both teach back in clinic and follow-up. I think that follow-up is so critical, because when she did go back, she told the doctor she had read about it, and her mind was fine and she didn't need it. Anyway, thank you for letting me share.
Well,
Yeah,
thank you
and
very
thank
much.
you. Yeah, thank you, Ms. Berta, because it really happens.
Yeah.
You know, sometimes it could be culturally, sometimes they're too, you know, like I said, there's so many things going on in their mind, overwhelmed to understand what is being taught to them. So that's why the teach back is very important. And I remember the Ask Me 3, we have to explain to them what is their main problem, right? So after that, explaining what is their main problem, what do they need to do? Okay, to solve this problem, and why is it important for them to do, you know, the intervention that we want them to do. Like their main problem, for example, is high blood pressure. So that's why, what do you need to do? So take your blood pressure medications, follow the diet the doctor prescribed to you, and then why is it important for them to do it? To lower their blood pressure so that they will not have any complications. So as make it simple, right? And there are really patients that are really, you know, no, I'm not going to take that, right? So that's why health literacy and patient education is very, very important.
Yeah, and if so much happens in between appointments, right? That perhaps influence the following appointment, right? Have you been seeing cases, Dr. Manalili, that they bring all the leads that they see in Google and they ask all the questions?
Yes. Yeah, and they will say this, oh, what I read is this, right? So we're prepared to respond to those kind of feedback or answers. So again, refocus them and then make them understand what is their main problem, what they should do, and why is it important for them to do that.
Yeah, it's so important to validate, right? So, okay, I
Yeah.
understand,
Uh-huh.
but,
Uh-huh.
and then you can explain that the situation, but this is the evidence base, and there
It
are
happens.
different ways, right? Depends on the circumstances, of course.
Yes.
Dr. Rosenfeld?
Yeah, thanks. And I think, you know, most people probably know what I'm about to say. And I think it's also the necessity to have community health workers and other health allies that are not in the clinical environment that can assist our community patients, whomever they might be, in asking and answering those questions outside of the clinical environment. It is a overwhelming, stressful environment. So you can give me all the health literate information, but I still am not going to necessarily process it in that moment. And so what are the mechanisms that we are building out to provide that cultural liaison, that communication that can talk to somebody and answer questions in that less stressful environment? Because not everyone has a Berta that can like
Yeah.
their mother and answer those questions and acknowledge perspective. And so what are we doing? So from a policy and from an organizational perspective, extending the four walls of our healthcare system
Yeah.
through community health workers, through community nurses, through a variety of other mechanisms.
Correct. Yeah, so I wish all communities have support like that, right? So that the patient can just go to that the nearest clinic and they can ask questions, or they do visits, right, to check on a particular group of people, for example, just to check on them if they have any questions or if they have any need at all. Because if they're coming from the hospital and for example, they were advised to go home with home health, for example. So the nurse or the PT that can teach them, they will not be there every day, maybe once or twice a week, but at least there's a support, right? And there's a follow-up that or a person that can answer their questions. So that would be a good thing if in each community have a hub of community health workers to provide that support to these patients.
Yeah,
That
how
is,
important is
that
that?
is so true. I was just going to say that is so true because, I mean, I knew that I could, through this nurse, have the doctor call her. And only through my connections that this happened. And it just makes me think of all those other times where if you don't have those advocates in the community that have the connections, and you were talking about all the collaborations that your group does have, how important those partnerships are.
Yes.
Yeah, Dr. Ventura, in your case, yes, exactly. Follow up just to see how you've been doing is something that we can help. how important is the work of the community health workers and the mission that they have, the heart that they put in every single action. And Cynthia de la Garza, do you have also something in the chat that you would like to elaborate a little bit more?
Sure. Let me put my camera on. So I worked for the geriatric primary care and palliative support at UT Health, and we had morning huddles every day. It was in regards to what happened the last 24 hours or overnight. So if there was any emergency calls from caregivers or patients. Also, we had huddles where we had an ACE unit right next door at Santa Rosa, and we got reports of who was hospitalized. And so we had to follow up once they were discharged within about 24 to 48 hours to find out, or nurses would call to find out any medical medication that was given. We had them scheduled back in the office soon so that we could go over everything and explain it to them. And then we had nurse practitioners and doctors that would go out on home visits and follow up with them, along with education from community health workers. So that helped a lot, and it lessened the burden on the medical staff to explain those. But we also had PharmD in our clinic. So it was a multi-step visit, seeing your community health worker, your clinician, and your pharmacist all in one day. So it was very helpful for those patients.
Yeah, particularly because as we all mentioned, we all understand that this overwhelming situation, it was mentioned several times when someone is discharged or new medication, like in the case for Dr. Cantu, or something that is questions on the doses. In that regard, there is also one. Thank you so much, Cynthia, for sharing that, and the importance of having a multidisciplinary team approach. It is always very helpful. Dr. Manalili, there was a comment from asking you, I guess, for the Ask Me the Tree. If you briefly can say something about that, I really like a patient activation. Yeah.
It's an actually it's a I just type it in on the chat. It's an educational program that encourages patients and families to ask 3 specific questions of their providers or healthcare providers to better understand their condition, their health condition, and what they should do, to maintain healthy. It's an evidence-based program that is being used by health practitioners. Aside from the teach back, it's like the teach back. It's a strategy. It's a tool.
Yeah, it is also because we've been using that as a diabetes educator for being prepared for 3 questions that you can ask the doctor. Exactly.
Like I mentioned earlier, what is my main doctor? What is my main problem, right? So what do I need to do? So why is it important for me to do this? Just like taking medications. So that's a strategy that we can use so that it's very simple, basic, and the patient can already get it, whatever question that they have in their minds.
Yeah, and we can start putting in practice, getting a little notebook and start getting those 3 questions. Thank you so much. Well, we are almost finished this hour, but I would like to say thank you so much for this participation in your presentation, and thank you all. But we have a couple of minutes. Dr. Zoni, if you would like to lead a specialist for today, give us a summary of the recommendations.
Yeah, no, thank you. Thank you for this wonderful presentation. I think it illustrates how the nursing field has been such long advocates of health literacy. I've been involved in the field since the mid 2000s, and already at that time, nursing, was the forefront of bringing health literacy education. So I love how you illustrated to us how to execute a professional collaboration. You brought all of these, or your organization has brought all of these affiliated organizations together under one umbrella. And as you mentioned, there's a strength in numbers. When you have so many healthcare professionals together, you have more impact, you have a voice, and I encourage you to use it for your community engagement, but also for advocating, because that is what our policymakers and decision makers need. Your goal is patient safety, and I think patient safety and health literacy go together. It's we do health literacy ultimately to bring increased patient safety. And I, of course, I loved your focus on community partnerships. These are tenets that we all know and believe that, we need to have trust, presence, and sustained engagement in order for our community to engage in healthy behaviors. So I also want to thank Dr. Cantu for her excellent case. I think it's such a quintessential case of how health literacy plays such an important role and can have such big ramifications. Something that may seem small at the time of your visit can turn into something really serious and significant. So thank you for sharing that with us. Thank you, everyone, for attending our final ECHO session. Jason and I hope to bring more of this to you in the future. And Jason, I don't know if you want to say something about the evaluation, but we want to get your feedback. We want to know what future topics and areas we should focus on.
Just a quick note before I hand it back to Raquel, please look for an email from either myself or from Angelo with a survey sometime next week. We'd love for you to fill it out. Just tell us what you've learned, how you're applying things, and how we can continue to improve these series. So thank you all. It's been a wonderful time spending these every other Fridays with you. Raquel?
Yeah, thank you so much, Dr. Rosenfeld. And these sessions are possible because of you, because of your participation. So your input is so important. Please bring us out all these thoughts and ideas on future topics, and also be prepared for presenting cases like Dr. Cantu did today. That is really eye-opening for all of us, and to learn a little bit more. ECHO is on Learn or Teach environment, so we invite you to please stay on tune and see if you can join us in our future session. This is the last one. I want to meet you all. I like it to see those faces. It has been a pleasure, an honor, and a blessing to me to be with you all, and thank you for your participation. In the chat, you see a link for the Admit Tree that Dr. Manalili put it, but also for earning those credits. So please go and visit us. Thank you so much, Heather, for putting it again.
Thank you, my pleasure.
Thank you so much. Thank you so much, all of you, and be hard. Thank you so much for everything.
Thank you.
Have a blessed day,
next time.
guys.